In this lecture, we are going to study about the nexus between global pandemic and mental health. March 2020 was when it all began. The World Health Organization declared COVID-19 as a pandemic. So far, it has been learned about the disease that most people who are infected by this virus will experience mild to moderate respiratory illnesses. Older population and those with underlying medical problems like cardiovascular disease, diabetes, hypertension, chronic respiratory diseases like asthma, and even cancer are more likely to develop serious illness, and in some cases, the virus may also lead to death. By early June 2020, it has been found that India is at the stage of limited community spread, and there is a lot of uncertainty regarding how this pandemic will unfold. So, how did we humans cope with it? This has been explained by applying the model of grief by Kubler-Ross to the current scenario. The process of coping begins with denial, when sudden negative change is denied by the subject. This is characterized by denying irreversible change and its consequences. There are numerous examples of world leaders denying the impact of the COVID-19 pandemic, as well as the common public carelessly going to social gatherings and behaving irresponsibly in public places, thinking and believing that they would not catch the virus. Indisputable evidence of the problem then leads to the next stage, which is anger, where the subject vents their negative emotions on some presumed causal factor or scapegoat. Often, the anger is mixed with self-pity that, why me? In the case of COVID-19, anger was directed at people of Eastern origin, non-vegetarians, and proponents of globalization, liberals, pharmaceutical companies, and government, among others. The subject then starts bargaining with the situation. Let me not announce an office shutdown and manage somehow. Or they could be saying, I promise to continue my daily routine safely. Or, if I can't go to work, I will lose my job income, so I must go. Or, I might be infected, but let me stay at home and try alternate remedies. In reality, the bargaining is futile and only creates a sense of false optimism. At this point, the permanence of change finally sinks in and leads to the next stage, which is depression. In this stage, the mind becomes unbearably sad and hopeless. The symptoms include lack of motivation or enthusiasm, low energy levels, and distracted participation. You could hear people saying, my business is doomed, or I will miss my examination, or my future is ruined. This is the tipping point for good decision making. Here is where intervention and transformation has to kick in. Delay in recovery can be difference between good and bad recovery. Luckily, most of us climb out of this abyss of depression pretty soon. We start seeing the need to move on when we accept the new situation. In the acceptance phase, we are willing to climb out of the depressing pit, experiment, and innovate. At this point, it is important to be generous, considerate, and lenient with experimentation and mistakes. Given empowering condition, the accepting phase can lead to rapid renewal and growth. Oftentimes, systems fail to cope with the crisis because decision makers are trapped in the quicksand of denial and depression. Inability to rebound and lead purposefully risks entire society, exposing large population to chaos. The immediate psychological response to the pandemic was a series of reactions, which included not knowing what to do, what not to do, feelings of uncertainty and worry and apprehension surrounded all of us. Fear and a sense of clear and imminent danger was on everyone's mind, with a lot of information, misinformation, rumors circulating in the media, and lack of clarity among the masses about the disease and its preventive measures. What we are experiencing currently is normal people being exposed to extraordinary situations. There is no denying that these are unprecedented times. We have never experienced something like this. Neither have our parents or loved ones. So nobody really knew how to make sense of this and move ahead. The psychological effects of the pandemic are multifold. It includes psychiatric and psychological problems that were pre existing in individuals even before the pandemic. Perpetuating effects of the pandemic on the pre-existing psychological and psychiatric problems in individual as response to preventive precautionary measures such as social isolation and lockdown has been given importance. It's essential to know if the symptoms have worsened due to the effect of the pandemic. Also, how as a society we are behaving with those who have symptoms suggestive of COVID-19 infection, as well as during the aftermath of the infection, how one is feeling. All of these factors have an impact on the mental health of the person. Stigma and discrimination also have detrimental effects, whereas financial, social, and emotional support has a positive effect. On the spectrum of psychological effects also falls the psychological response to the diagnosis of COVID-19. Those infected may also suffer from psychological reactions such as stress, anxiety, depression, or other mental disorders as a consequence of extreme feelings of distress and excessive fear due to the diagnosis of COVID-19. As we are studying, COVID-19 is creating immense psychological and sociological disturbances. The disease involves an unfamiliar threat that is difficult to detect and challenging to distinguish from more benign illnesses like, say, common cold. It has been causing emotional and behavioral disturbances ranging from mild to severity. They can result in, say, fears of losing job, fear of being socially excluded, fear of being in the quarantine or alone, avoidance of health checkups despite flu-like symptoms, hiding health-related information when a medical examination is indicated, losing hope when infected, intolerance of quarantine or staying at home, feeling helpless or hopeless, feeling pessimistic, lonely, depressed, getting panicky when there are physical symptoms of other conditions which may mimic the symptoms of COVID-19, major sleep problems, significantly reduced appetite and even considerate level of weight loss, suicidal ideation or acts. As we all know, cases of suicide have hiked during this phase, completely avoiding interactions, obsessively monitoring physical symptoms, inability to concentrate and feeling really confused, finding it difficult to ask for help from others, excessive sweating, feelings of nervousness most of the time during the day, not feeling hungry, or in fact overeating in some cases, feeling bored throughout the day, very unproductive, having constant headaches, preoccupation with the obsessive fear of being infected by germs and viruses. Other symptoms may include increase in one's alcohol, tobacco, or drug consumption, and having a lot of difficulties relaxing and feeling constantly alert and vigilant and on the edge, losing control over our emotions, a frequent urge to cry, getting frustrated, angry, snapping at other people, constantly having the urge to check news updates about the new cases and the death count, worrying excessively, having difficulty expressing feelings. All of these can become severe and cause severe mental illnesses like depression and other anxiety disorders like phobia, panic, generalized anxiety disorder, and OCD, which is obsessive compulsive disorder. So, in this lecture, we discussed about the emergence of COVID-19, explaining the stages of coping during these times using the Kubler-Ross model of grief and drawing parallels between grief and uncertainty. We also learned what the psychological reaction has been towards the pandemic and the preventive measures like quarantine and isolation. Lastly, we have also learned the mild to severe range of various emotional and behavioral disturbances that have emerged as a result of stress induced by the pandemic.